Hey everyone, welcome to Lost in the Sauce. We're your hosts, Maddie
and Maeve, and like most college students, we're just trying to figure out life one confusing moment at a time. Each week, we sit down with real students to talk about the pressure, uncertainty, and those what am I doing with my life moments, because none of us really have it all together.
Today, we're talking with Lauren and Beth, both nursing majors who have some real insight on what it's like to pursue a demanding program and figure out your path along the way. We'll be diving into the challenges, emotional high and lows, and what it really takes to stay motivated when things get tough. So, Lauren, do you want to start by introducing yourself?
My name is Lauren. I'm a junior nursing student at Quinnipiac. I'm from Naugatuck, Connecticut, so that's only like 25 minutes away from campus. Oh, I have a minor in psychology. Mm-hmm. Which is fun. But I don't actually know if I'll use it, but like, we'll see.
Beth?
And I'm Beth. I'm a junior nursing major at Quinnipiac. I'm from Rehoboth, Massachusetts, same hometown as your lovely host, Maddie. Yeah, and I don't have a minor.
Awesome. When you guys hear the phrase lost in the sauce, what does it mean for you? Lauren, do you want to?
I think it's like a funny little phrase to use, like just to say you're like confused, like you don't know what's going on. But I feel like that's me half the time. Like I never know what's going on. I'm horrible at time management, so I really never know what's going on. And like I'm typically lost in the sauce.
Yeah. Beth, what about you?
I feel like in nursing, like there's just always so many assignments and exams. I just get lost in the sauce a lot. I have to like pull myself out and be like, okay, like just focus one day at a time.
Yeah, for sure.
That's like how I go.
Yeah, I feel like the word, you can use it with a lot of things.
Yeah.
It's kind of fun. Like you just know what it means when you say it.
Yeah.
Have you guys ever felt lost during college, whether it be like academically, socially, or personally? Just in general, it doesn't have to be related to your major.
Yeah.
So I didn't start off as a nursing major. I applied here as a biomedical sciences major. I started to go pre-med, but I knew I wanted to do science because I was really good at bio and chemistry in high school, but I didn't really know what I wanted to do. I kind of steered towards biomed because it was such a big umbrella where I could find something under it. Then I kind of decided I didn't want to do pre-med, but I still was getting all those emails and going to events just to keep my options open because it was first semester freshman year. Like I didn't really. And I wanted to do like immunology, like lab work. Then after I had gotten into Quinnipiac and committed in like March of my senior year of high school, that was around the same time I got my CNA certification. And then once I started working as a CNA at a nursing home, I realized that there was just like actually no way I was going to be able to work in a lab and not talk to people all day.
Yeah.
Like, that just wasn't going to work. Like, I talked too much to be trapped. As cool as I thought it just wasn't going to work. So then I picked up nursing because everybody told me there's so much to do in nursing that I could get my NP and be a prescriber and not do as much bedside.
Especially because you were CNA. You know,
yeah.
kind of was like you knew before you knew. You know what I'm saying? Beth, what about you? Have you ever felt any?
Definitely like last year, sophomore year, like classes were getting harder. Had some like friend drama.
Yeah.
So it was definitely hard, but I feel like I like grounded myself and like figured out why I was doing what I'm doing. Mm-hmm. And so that kind of pushed me to like go through it, and there's light at the end of the tunnel.
Yeah. Mm-hmm. How do you usually cope or reset when you're feeling unsure or you have like moments like those?
I just surround myself like with my friends and just do things that make me happy.
Yeah, same thing. I try to make time for myself to like walk away from that stuff because I feel like sometimes, especially during like finals week or like last week we had a bunch of exams and I feel like we got really caught up in like that was kind of all we talked about. So
I feel like a big thing in like nursing, like where we get like lost in the sauce is like everybody's talking about like grades and like what they got on this and did you finish this assignment? Yeah. And it's just like me and Lauren talk about it all the time. We have to like step back and be like, doesn't matter what they got. Yes. It doesn't matter if they did the assignment already because at the end of the day, if we get to that finish line and graduate, that's all that matters.
Me and Maeve had talked about that like similar like stepping away is like one of the biggest things you should do when it comes to like getting lost, because I remember a couple episodes ago I was talking about, like, when I'm at Q30, like, everyone is talking about the same thing. Mm-hmm. All the people in my classes, they're all talking about the same thing, the same internships. Mm-hmm. Kat even mentioned it, too. Like, you just gotta step away. Like,
and with you guys, with you guys being roommates, too. Like, roommates, like, having people in your circle, like, be different majors is really important, I feel like, too.
Yeah, for sure.
I think that's the coolest thing about this suite is because, like, we are so diverse. Like, me and Beth are the only people that are the same major. Like,
Well, we got College of Arts and Sciences, School of Nursing, School of Business and School of Comm.
Yeah.
Wow.
In one
we're so
suite.
we're so inclusive.
But I think that's why it was so important for me and Bethany to like have a conversation about like we don't talk about grades.
You guys want to talk about that a little bit?
Yeah, so we like literally the first week of the semester we were driving home and we just like set a boundary with each other. We were like, we're not gonna like discuss grades or like just go super in depth like after an exam, like, oh my god, what'd you put for this answer? Because it just all it does is create stress and like.
And a lot of people in nursing do that because we all take the exact same classes. We're all taking the exact same tests, so it's so easy.
And a lot of us are friends. Like,
there's
big friend groups in nursing.
What'd you put? What'd you get? Like,
even that last exam you were talking about, it like kind of like makes you resent some of the people.
Yes.
Like you get mad because you're like, I don't want to talk about this.
Yes.
Yeah.
I'm really glad that me and Bethany did that because we don't feel the need to like compare each other. It's just like, do you feel good? Do you feel good? Good.
Right. Yeah. No, that's super healthy. You guys ate with that. Good job. Very mature, very healthy. But steering away kind of from coping, have you guys ever had like a big turning point or realization, whether that was in school or like before school even, that like helped you realize like, yeah, this is what I want to do?
Yeah, I know you kind of got into it.
Yes.
Yeah, I know. I kind of talked about it before. It was just like, it was really like seeing people at the bedside that like made me want to do it.
Yeah.
Like I was very fortunate. Not a lot of high schools do the CNA program, and I kind of just fell into it because once again, like I didn't plan on being a nurse.
Yeah.
So I kind of just fell into it for like an extra science credit and just like a cool thing to try. And I ended up really liking it, and I still work at the same place I applied to.
I feel like I haven't heard a lot. Was that process like easy transferring like just into the School of Nursing itself?
Oh, they're like, well, you have to remember, like, class of 2027 is huge, and that's not just, like, as a whole, it's, like, School of Nursing. Like, all of our classes are massive.
Yeah.
So it was very difficult to get in, because there were a few people in the meeting I went to, it was, like, transfer into nursing meeting, and I think only a few of us actually made it through, because I don't see any of those people, like...
Well, because I remember you were saying that there was a kid in journalism who wanted to become a nurse.
Wow.
Like, what?
He was a junior journalism student.
That's
trying to
nuts.
transfer into the nursing
That's
program.
actually nuts.
Yeah. Yes, I remember him.
Yes.
But he made it in. I remember seeing
what?
him in my bio
Wait,
class.
that's crazy.
I remember. I
he was definitely lost.
He was lost on the side.
That's okay.
Like, definitely in high school, like, my grandfather, he had dementia that was, like, progressing. So just helping him, like, really made me want to become a nurse.
Yeah.
I already, like, had the idea, like, literally since middle school. But that was, like, an eye-opening moment. And then also, like, sophomore year, like, anatomy was so hard. And I was just like, why am I doing this? Like, why am I studying? Why am I getting so upset about these grades? And it was because I, like, want to become a nurse. Like,
yes. That's so
I want to
cute,
help
though.
people. Like, that's just, like, my biggest goal. So, like, if I have to study for 10 hours a day, whatever.
Yeah, that's awesome.
Yeah.
But that's what I like about you, Bethany, because there's some people in our classes right now that, like, don't care about their grades and, like...
Yeah, and don't care. I know we can get into it later about the people in your clinicals. We can talk about that later. But no, like, that really shows that you care, and that gives me... Because I know, like, we've also talked about stereotypes when it comes to majors, and, like, obviously, nurses have the bitchy stereotype. But, like, hearing that is so refreshing, it, like, knowing that, like, people, like, actually do care and stuff like that. But moving on to more, like, specific questions, you kind of already dipped into it a little bit, but where were there any moments that you felt like completely overwhelmed or questioned if you were on the right path at all?
Mine was definitely in anatomy.
There was like there was days where I was like, I am not built for this. Like, I cannot do this.
Like anatomy.
Like, all of these bones have different names. I don't know how to spell them. I'm gonna pull out my hair.
Yeah.
It was so bad.
Yeah.
Because there was, like, I swear to God, there was a phase fall of sophomore year where I had 3 exams a week for, like, 3 weeks
I remember
in a row.
that, yeah.
And, like, most of them were in my psychology classes, so it was fun. It was fun.
I remember when you'd have your psych exams, you'd be like, oh, it's fake.
Yeah. Sorry, psych majors. I didn't find it that... Whatever. It was so bad.
Yeah. Just the content was really overwhelming and stuff.
It was, like, I felt like I didn't have a moment to breathe, but also, like, anatomy is not easy. Like,
oh, for sure,
and other classes, too. Like
on top
of other classes.
exactly,
like,
Like that,
like
the curriculum's nuts. Like, yeah, like we have an easy major for sure.
It's like project-based.
Project-based. Exam-based majors, I can't. No. Glad we're on the right path.
I did biomed in high school and I did all of that.
Yeah, Maeve did biomed.
Yeah.
We talked about this last time.
I actually thought I was going to go into medical field or health science. Yeah, maybe I'll be at that nursing trip.
Yeah, maybe you'll be the journalism nurse.
You graduate this year.
That's how I remember looking at that guy. I was like, oh my god, like
what?
Because all the bios and everything are like nursing bio. Like he had to like go
back. There's nothing like, because sometimes I feel like when obviously like there's some people that will switch their majors like complete tail ends of things, but like normally it's kind of relative, but like there were nothing like he had to completely start over. Like he's brave for that. Whoever you are.
That's like, like marketing to biomedical marketing. Like that's like
that's
good for him. I hope he's doing well. Maybe you should have him on the podcast.
Yeah, facts. We'll find him.
Actually.
I really wonder where he's at. I don't know.
Facts. Beth, were there any moments you questioned nursing for you?
The first like 2 years of our degree, like it's just regular classes, like 2 times, 3 times a week. Yeah. So transferring to like their nursing school, like all of our classes are once a week. We have clinical for 8 hours. We have lab for like 4 hours. Mm-hmm. So it's so much different than like regular classes. Just in that like transition period, like they gave us like an orientation, but I just remember being like, I'm so stressed. Like, there's so many different like platforms and assignments and like test grades are like 70% of your grade.
It's nuts.
Just stuff like that can get really stressful.
Yeah, one of my suitemates is nursing, and she was talking about like all like these tests where it's like, no, if you fail, like you're
done. Yeah,
which is crazy. Is that very stressful?
Yes.
We were trying to figure out the other day. I still can't remember. I think you have to have a 77 in the class to pass, and a 73 test average. Yeah.
Wow.
And the exams is like, so this semester we had two exams in each class and then the final.
Yeah.
So it was 20, and then the final's 30.
Wow.
For 70.
Wow. Yeah.
And if you don't get the 73 average on your exams, like your assignments and attendance don't count.
Like you could have an 83 in the class, but if your test average isn't a 73,
then you still
don't pass.
Yeah. That is sick work.
Yeah.
Oh my god. Ew.
Is finals week gonna be very...
We have 3 exams, so back like 3 days in a row.
Yeah.
So. Yeah.
At 8 a.m.
At North Haven.
So they'll be interesting.
And that's everyone has the same.
Yeah.
Wow, that's very...
Yeah, that is interesting.
Yeah.
Do you like this now that you're at North Haven and you're actually doing nursing stuff?
I love it.
You love it.
Yeah.
Like
it's I
love this so much more than like just going and sitting in a class for like 15 minutes, like 3 days a week. I'm just like
because my sweet mate, she's like she's never on main campus.
Yeah,
and it's cool that like what works. Like we live on a different campus, and then you guys have class on different campus.
Yeah,
so that's really cool.
Yeah.
Kind of moving on to the next question. This like we kind of talked about this a little bit, but do you find it hard to balance like the intensity of like academics, clinicals, and like trying to have a normal college like social life?
Unfortunately, this semester I was blessed with a Saturday clinical.
I knew you were going to bring this up.
I was blessed with a Saturday morning clinical 7 to 3. Which sucks because I can't do anything on a Friday, and I had a lot of FOMO at the beginning of the semester because it felt like everyone was like, oh my god, this is so much fun, let's go out on a Friday, and it felt like no one was going out on Saturdays for some reason. Like,
honestly,
like Saturday night, I was like, alright, what are we doing? And everyone's like, no, like, I still am tired from last night. Like, I'm like, wow. So I was just having FOMO, but I've learned to be okay with it because it's what you make of it. Like, there's nothing I could do about it. And next semester, me and Bethany both have Saturday clinical.
Yeah.
Oh,
and you have your clinical group too. Like,
yeah,
have it too.
Yeah. So like,
do they make it better?
Some of them.
Some of them. Do you want? We can talk about it now. I guess. Like, back to what Bethany was saying when you were like I care. Do you want to talk about some of the people that don't?
Oh, do you want to go first?
Sure. I feel like we've talked about it, like, just in, like, our clinical groups, like, there's just some people that they just don't act like they care. Mm-hmm. Like, and it's weird, because, like, again, like, why would you put yourself through this, like, such hard major if you, like, are scared to go in a patient's room, or, like, and it's, like, I was scared on my first day, like, Lauren's a CNA, like, she's talk to patients. The first time I ever talked to a patient was in, like, September.
Yeah.
So it was terrifying, but I still did it.
Yeah.
Because I, like, wanted to.
Yeah.
Like,
these people are acting like they're being forced to do it. Like, you chose
that's
this.
just not the case. Like, you chose this, so do it.
Yeah.
It's, like, weird.
I feel like there were a few girls in my group that just were kind of almost, like, waiting for somebody to do it for them.
Yeah. Oh,
like, they didn't want to take the initiative to actually, like, whether they were scared or whatever. That's not what I'm saying. Like, it is scary. You're walking into a hospital for the first time. You're walking into a patient room. Like, how do you go from, hey, my name's Lauren, to, hi, I'm Lauren, I'm going to be your student nurse today. Like coming, like, that's a weird thing to overcome, and I get that. It's just, it seems like some people don't want to.
Yeah, and I think
whereas I feel like we were so excited for that.
Right, yeah. And, like, obviously there was, like, the dread when it came to, like, it being a Saturday morning, which sucks and stuff, but, like, I know, like, I feel like when it comes to nursing, at least, and you can correct me if I'm wrong, but it, like, takes, like, a certain, like, level of independence that people don't necessarily realize that they should have. Because, you know, like, people, like, when looking at, like, the healthcare field, you think, like, nurses work under people and are told what to do. But I feel like a lot of them got to know what they're doing, obviously.
And, like,
you got to make decisions on your own. Like,
and, like, I didn't even fully realize that, like, until I like, went to my clinical, and I'm like, because providers give the nurses orders, but like, if something happens to your patient, it's up to the nurse to be like, hey, we need to do this, 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 and this. Like, you're the person at the bedside. Like, the provider, they're, like, God knows where.
And, like, you have the most liability because you see it first. So if there's something wrong and you don't realize it's wrong, like,
that's on you.
That's on you.
Yeah.
No, I also think it's funny because, I've worked in, like, a nursing home as a CNA, but I work under LPNs. And
which are?
Licensed practical nurses, and they're under RNs.
Okay,
so they don't have.
Okay,
they take the same. They take the NCLEX.
That's a 2-year program. Right?
Yes, so they take the same exam as us, like the NCLEX, but they just didn't go to. They didn't get a bachelor's degree.
Oh, got you.
Yeah. It's it's like a little bit different. But they're not able to do as much as an RN. So it was interesting seeing it because at the nursing home it felt like a lot of pill pushing. Like, it was very much like, here's your med pass, here's your med pass. Whereas at the hospital, registered nurses have a lot more responsibility. And I'm sure it looks different for LPNs wherever they are. But like, I was so used to seeing it as like they give medication, they chart, they give medication, they chart, they do the treatments as far as like little wound stuff. Whereas RNs have to deal with these like huge IV machines that like look so complicated and overwhelming.
Back to the original question and to Bethany, how do you usually balance like the intensity of like academics, clinicals, and trying to have like a normal college life? Because you have Tuesday night clinicals.
Yeah, so I feel like my weekends have been good. Tuesday nights, I like it, like 3 to 11. I love the hospital I'm at. Like, I love my group for the most part. Like, it's fine. But then, like, when I get home, I am tired. And then we have class at 9 a.m. on Wednesdays.
Ugh.
So I am tired, but normally when I get back, I'll just take a nap. Next semester will be a different story.
Yeah, because you have Saturday, Monday?
Yeah, so we have 2 clinicals next semester, and then all the other days we have 2 lectures on Tuesday and Thursday, and then lab. And do you have lab?
I have lab on Mondays. I
have lab on Wednesday. Yeah.
Yeah, so you have Saturday, Monday, you have
Wednesday, Saturday.
Wednesday, Saturday.
Like, we're all juniors, but like, our course schedule is like so weird. Like,
so weird,
like we're graduating seniors, and my course load is like literally so light that I could have Mondays and Fridays off, which is like insane. And I feel bad saying that right now.
Sorry, guys.
But no, I think people say that though, because it's like, like we want to do this.
Yeah.
Like, you're passionate about that. We're passionate about this. Like,
That's how I feel about it too. Like, I complain about it. I'm like, oh, I'm so tired, but like, whatever, like, that's what we have to do.
Yeah.
So we just do it.
But also it's valid to, like, complain.
Yeah.
With that, I know a lot of nursing students talk about, like, burnout, like, or kind of, like, imposter syndrome. Like, have you felt that? And, like, how do you deal with that?
I haven't really felt any burnout yet. So far, like, I've felt pretty good about everything. But definitely is a concern, like, going into our next semester, like, it's going to be a really hard semester for us. I'm, like, nervous for that, but hopefully no burnout.
I think post-grad too, like there's so many different paths you can go with nursing.
Yeah,
so
definitely.
That's kind of nice. Like, yes, you have a nursing undergrad, but bachelor's degree, but you can always change paths, which is
cool.
Yeah.
And what about you?
Yeah, this semester I feel like I've handled it pretty well. I'm just worried about next. Everyone says spring of your junior year
is
the hardest.
Yeah.
So that makes me nervous.
Is that because of the 2 clinical?
That and just the classes, like we're taking pharmacology, we're taking med-surg, pediatrics, and maternity.
Just for people who don't know, aka me, what does med-surg mean?
Med-surg, so that's the clinical that we're at now. Okay. So it's just like a bunch of different patients. Like we have surgical patients, we have patients that were like admitted from the ED, like pneumonia, flu, like appendicitis, like stuff like it's really broad spectrum. Honestly,
it stands for medical surgical. The way I like to explain it is it's any like overflow, because you think like if you have like a big heart surgery, you go to the like
telemetry floor.
Yeah, the telemetry floor. But if you don't necessarily need like specialized care and you just need care,
like
you go to
general.
It's
like general.
Okay, that makes sense. Yeah. No, that makes a lot more sense. What has been one of the hardest or most emotional experiences that you've had this year? And that could be any clinical experience or any class experience or just any experience at all.
Here's a perk of having a Saturday clinical is that there's always random stuff happening on Saturdays. So for example, 2 weeks ago we got an email saying, hey, you won't go to your clinical on the first week of November. You're going to go to this community event in Meriden and you're going to volunteer, and we'll explain more later. And we kind of
Stay tuned.
Yeah. And they were like, okay. And they were like, okay, what's your t-shirt size? And we were like, okay, but like, what are we doing? Like, like we don't get it. And then we showed up and I actually understood what was going on. So essentially, anyone from the community that say like, didn't have health insurance, was unhoused, et cetera, could come to this event, and there were all sorts of volunteers, nurses, nursing students, doctors, pharmacists, podiatrists, like dentists, eye doctors, like so many people everywhere. So essentially, like people come through, they get their vitals taken, their height and weight, they get their finger pricked to check for like stuff in their blood. Then they met with a physician, and I was a navigator for my thing, which basically meant I walked someone around all of these stations so that they knew where to go. And when I say they were in with the physician for probably an hour and a half, it probably was an hour and a half.
Wow.
And like, think like when you go to the doctor's office, you talk to the actual physician for what?
Like literally not even 5 minutes.
Yeah. And it was just fascinating because like they had said, we haven't been to a physician in years.
Yeah.
So they had so much to talk about because, I mean, the guy ended up having like hyperglycemia, like high glucose and stuff like that. So there were a lot of stuff that needed to be handled. And then the prescriber, it was so cool. The prescriber wrote a prescription and they went to the in-house pharmacy at this like elementary school setup thing, got medications, got other medications that they already had refilled. Then my guy got a haircut. There were barbers volunteering.
That's awesome.
That's so cute.
Yeah. Everybody got a brand new pair of winter boots. Everybody got a new winter coat. Everybody got gloves, hats, socks. It was so cool. And they all went home with lunch. You could get glasses if you needed an eye exam. That's like the first time ever I've seen healthcare in that way.
Yeah.
I don't know how to verbalize
No,
that.
I know, I understand.
Healthcare in the community in such a beautiful way, because when you looked around and you looked at all these people helping out, everyone looked happy, and they were all volunteers. Nobody was paid to be here. Everybody wanted to do this, and it was so interesting because it felt like the people that were walking through coming for medical care almost were a little embarrassed to be there, but by the end, they were just like so happy. Like my guy, you could tell he was a little nervous walking in, and then by the time he got a haircut, he was lit. Like he was up. It was so cute.
That's awesome.
And so also, like, I feel like you don't see like all people from different branches of healthcare together too.
Yeah.
And especially outside like a hospital setting, it's like more like human. Like,
no, for sure. Yeah, definitely.
No, it was like so human and precious. It was really cute.
That's awesome.
Being a student nurse, it's awesome because like we only have one patient. So sometimes like I just go in there, sit and just talk to them for like 2 hours.
Yeah.
And that's like so awesome because their families visit and the nurse comes in, but the nurses are so busy. They have 5 to 6 patients. Like they can't sit in the room and talk to them. So I've been grateful to do that and just like have little bonds with patients. And like sometimes I'll come back like a week later and my patient will still be there.
Yeah.
So like just to pop in and say hi.
Was there a specific experience that made you rethink your goals or like what you want to do with your degree? I know that we talked a little bit about how with nursing there's certain like pathways you can go, certain like concentrations.
I've always wanted to do labor and delivery. Like, that's, like, my biggest dream.
Yeah. Wait, you came home from clinical and you were like, another baby was born?
Yeah, it's so cute. So at the hospital I work, or have clinical at, whenever a baby's born, they play, like, a little nursery rhyme over the whole hospital.
Wait, stop it.
So it's so cute.
I'm not a sucker for that, but that's really
like,
cute.
It's so cute. I literally, like, stop in my tracks and I just, like, I'm smiling in the hallway. Everyone's probably like, who is this girl? But I love it. So I've always wanted to do that. But there's, like, this, like, stigma where, like, you can't go into, like, a specialty as a new grad. You have to do med surg, like, yada, yada. And, like, I feel like it is good experience, but, like, you don't have to.
Yeah, you
like,
don't have to do whatever.
Like, there's so many people that just go and do whatever they want. But now, like, I'm more interested in, like, doing peds.
Okay.
Yeah, but it will be good next semester because
Yeah.
that's our clinical, maternity, and pediatrics, so.
I feel like we're going to learn a lot next semester because...
And we have med surg again, so.
Yeah.
For me, I have no idea. Folks would say I'm lost in the sauce. I literally, like... I was making Maddie, like, look at my computer yesterday and be like, just pick something for me. Because I was looking at a paid nursing internship, and it had, like, 10 options where you had to, like, rank your top 3 of what you would want to do. And I just have no idea. And I was like, Maddie, just do it. And she's like, I'm not doing that for you. But I just, it's so hard because I don't know what I want to do. I think it's because it's hard to choose what you want to do when you haven't been exposed to a lot.
Yeah. That's
like,
why I was like, just get rid of the stuff you know you don't want to do. Because I knew that made it a little easier.
Because you talk about the event that you went to, and, like, yes, those are different, like, career paths other than nursing, but, like, also, like, there are different pathways, like, in nutrition.
Yes, that would
and,
be, like a community health nurse, like, where you're going into the community and, like, doing something like
there's
that.
so many, like...
Yeah, we keep coming back on this point, like, not, like, even with, like, a major so, like, structured as nursing, like, people still don't realize how many things you can do with it. Be like, oh, you're just a nurse. Okay, what type of nurse? Where? Like, do you travel? Like, you know what I'm saying? And I don't even know, I know shit about nursing. And, like, you know what I'm saying? But, like, we talked about it with accounting, we talked about it with journalism, like, all that stuff. And so there's a lot of things that you can do with nursing, even if you think, like, oh, you're going to go into the major and, like, you're going to be a nurse. But, like, you can still find yourself lost. But I think that's, like, the beauty of it. Because, like, then you realize how many things there are.
I also think half the beauty of it is that you could try labor and delivery and, like, end up hating it.
Yeah.
And then you still have a degree. You can go do something else.
Yes.
Like, you could do, like, the complete opposite. You could end up, like, in critical care. Like,
Are there any specific paths that, like, you do have an interest in? You don't have to narrow it down to one, but are there multiple?
I definitely...
You said you want to work with the crazies.
I do like the crazies.
You're a psych major.
Yeah, I do have a psych minor, so
you want to
I
talk a little bit about that? Like, why you chose the psych minor?
Yeah. You're in the we're in Greek life.
Oh, I'm in Greek life. I'm in Greek life. No, I just got into the Psychology Honor Society. But thank you.
Congrats.
I was always very passionate about mental health because I saw a lot of dementia at my nursing home, and I've seen a lot of aides treat patients the wrong way with dementia because you have to reorient them. When they're disoriented and don't know where they are, don't know what time it is, you have to bring them back, and a lot of people don't do that.
Yeah.
So then I was interested on, like, other interventions for other mental health conditions, like, bringing them back. I like the idea of working in maybe not a psych ward, but, like, a behavioral health type of deal.
Yeah.
The only thing see, this is my push and pull with picking something, because you don't get to do a lot of nursing skills in behavioral health. It's a lot of behavioral management. It's not a lot of the stuff we're learning now, so you lose that. Yeah. But I don't know. That's why I'm excited for next semester, because I feel like I've seen a lot of geriatric and, like, med surg where I've never seen peds. I've never seen maternity.
That'd be really cool.
Like, I'm excited to see new stuff and figure out what I like and I don't like.
That's good. Being vulnerable for that is, like, always the best thing. But when it comes to feeling lost in the sauce, we can be a little full circle. What helps you reset or remind yourself why you chose nursing in the first place? And what advice would you give to future nursing students like you guys?
Just focus on yourself. Like, it sounds so cliche, but, like, that's what's going to get you through this, because you're the one taking the exams, studying, going to clinical. Also, just, like, put yourself in places that you're uncomfortable in. Like, you're uncomfortable to go in the room and like watch something you've never seen before, just do it. Because I've been there. I've been like, oh, I don't know if I want to go like watch this like port be changed. But like, I just go because I'm like, I like want to do this so bad. So don't let others discourage you, or don't get lost in the sauce and like what everyone else is saying, or like what they got on the exam. Like, just focus on yourself.
Follow your heart. And I know that sounds so stupid, but like,
it's not though.
But it's not. Like, you, at the end of the day, you know you care. You know you want to do this. Yeah. So let your work show that. You don't have to get straight A's and perfect scores and be the most perfect like person. Caring is what matters. Yeah. Because nobody's going to remember that you got 4.0 in nursing school. Everyone's going to remember that you were the nurse that came in and was nice.
Yeah.
Oh, you ate
and
with
actually
that.
cared.
I went to your guys' white coat ceremony for my roommate, and like I think the speaker talked about that. Like, how, like nursing is like so much more than just like the academics.
Yeah, because at the end of the day, like if you got a 3.0 or 4.0, you both graduated. Same thing.
Kind of wrapping things up, kind of going back to a more of a general question. What's one thing right now that you guys are excited about, even if it's uncertain?
I'm excited for winter break, just so that I can go home, see my family, and like recharge for the next semester. I'm also excited for the next semester, but really nervous.
That's okay,
it'll be good. And I have Lauren.
I'm also excited for winter break. I feel like I tell them all the time, like, I love you so much, but I'm so excited to go home, just because I feel like here represents like school and stress and sadness. So I'm just like, oh, I need to go home, like, love you guys, but I gotta go. So I'm excited for winter break.
No, I feel the same way.
Same.
I think it's good to have breaks.
Oh, for sure. Yeah. Well, thank you guys so much for joining our final episode and being a part of our podcast.
Thank you for having us.
Yes, of course. Your insight was greatly appreciated.
And thank you guys for listening to Lost in the Sauce. We'll be back for season 2 for more conversations about figuring it out, whatever it is. Thank you guys for listening to season 1.